everybody on this occasion of Occupational Health Day. I welcome our very senior public health specialist and specialist on other discipline. I just want to say that you must be feeling they say public health people or community medicine people. It's not true. Here you have very senior surgeons, we have physicians, we have public health specialists, because the discipline which cater the occupational health is not only just a domain of public health, but I think everybody is involved. So it's a very proud moment for Department of Community Medicine and also the Vardhaman Mahavir Medical College that we have host this very special day of occupational health. I welcome Dr. Shivlal. He is a Dayan or a pioneer of, you can say, public health in India. If I speak few words, it's not enough, but I can say that he is the special DG of Government of India, was former special DG, and he has looked after the National Center for Disease Control, one of the leading institution in public health, and he is the one who has started IDSP. You must be reading, and I think you must be having the examination in which the IDSP, the Integrated Disease Surveillance Project or a program has been, and also the the Enhanced Malaria Control Program. He's the one who has started in India. So we have people like Dr. Shivlal, we have Dr. Brahm Prakash, who is a pediatrician and moved to railway and then hold various positions in a very higher position. So I welcome you, sir, for this day. We have Dr. Sarvade, again public health specialist and work in UNICEF for a long period, and now he is the vice president of our Indian Association of Adults in Health. I welcome you, sir, for this occasion. We have Sunil Kapoor, CMD of Northern Railway. Actually, you know that railway is a separate ministry, and it is the biggest, which used to have a separate budget also. So India, when we say railway, is a very big thing. So holding the higher position, and we are proud that he is here. We welcome you, sir, for this occasion. We have Chandra Tripathi. She is Vice President of IAOH. I welcome you, ma'am. Now, what is required to be understood here, that this is the day where we just focus on occupational health, but when it came to us that should you organize this day in Vardhaman Mahavir Medical College, I accepted this because of one reason, because it's deal with the informal sector. Now you must be thinking that why we have to talk about this occupational health of informal sector and doctors, why we should talk about it. I'll tell you that, if we have the 100% population, the more than 50% of the population is actually working, and they are the producing whatever the development we see in the country and the world. Actually, these are the people who are looking after. And in India, out of this total working population, the 90 to 95% of the actually population working in non-formal and informal sector. So a huge population which is doing something for us, and we are doing nothing. That's what we want to say. As a doctor, what we have programmed, as a government, do we have any schemes? That is why action, is required. Some kind of action is required in this area. So we are fortunate that this program has been, initiated, and we have very few number of speakers because the time is only just 2 hours. We have one person, directly working in the field. She has worked PhD thesis in e-waste management. The worker working, all of you must be working on the computer, and when you throw it, where it goes, how it affects the environment and people, that's all is important. Then we have person, Dr. Ranabir is there. He's working in ESI hospital. Again, a big, social scheme of the government who is looking after the formal sector. And we want to ask him, what are the schemes now government is planning for this non-formal? and whatever they do is less. I think if they start today, maybe I think another 20 years is required to handle the whole informal sector. And you know what is informal sector? I think all big people are going to talk about this, what is informal, what kind of work and problem are there. So it's a very important aspect of us, that how we can orient ourselves to handle, you know, how much problem we are facing every day in our clinic and hospital, you know, can be handled by us just by simple orientation of the problem. Whether it is ergonomic or maybe some kind of exposure, can be a respiratory, cardiovascular, you know, name any kind of disease which is not linked with this work which is there all around. So it's a very great day. We all are grateful to everybody. I welcome you, my all other colleagues. We have the Department of Forensic Medicine, Microbiology, Anatomy. All people are there. Our students are there. We have the, you know, people from you know, NIHFW. We have from Maulana Azad Medical College and other medical colleges also come together. We have people from IAH, IPH, IPHA, Indian Public Health Association members are also there. I welcome you all. You know, whatever is a small period we have fixed for us to discuss is to discuss each other and learn how best we can do in the next coming time. So I welcome you everybody. Thank you very much.